and gave him little instructions to clean.
हाँ, नेक पे ऐसे लगा लो या नेक या ईयर पे लगा लो, ऐसे भी ठीक है.
So I did not change. So I did not change the medicine. I still gave continued with it as well only just to see whether the symptom has come out with the action of the medicine or some other problem. But it went away after some time. I gave him little instruction with the change of medicine like ये दवाई आप लोगों को देना होगा. So it was SL. He made them this and that, and he improved a lot. This was the case which I gave this sodium list of this. And there are so many others, but this I remember where I did not give any other medicine during the treatment. Only this medicine.
So this is what is also mentioned in our detailed experience. Ailments from apprehension, especially with apprehending and engagement, or when we write in the older Medica regarding attending church or attending an opera, and you're seized with a lot of nervousness, panic, we might have what we call nervous diarrhea, that kind of situation. So, yeah, and then you also see what we call the slight intensification of simple and slight medicinal activation. So now we are going to have on SL. So that symptom also goes away. Sir, आपने भी यूज़ किया होगा? जी, राइट होगा इसको फोकल और पॉइंट.
सेंटर में टूल एंड रेंज का काम करता है, बहुत बोलना पड़ता है. और उसके साथ गैस्ट्रिक में बहुत काम और उसका आवाज़ चला गया बिल्कुल, वो बहुत एंशियस हो गया है. और मेरे पास तकलीफ नंदी को कर दिया स्ट्रॉन्ग रिपोर्ट खत्म हो गई. नेक्स्ट टाइम जो पूरा उनका नाम भी वॉइस नाम से चेंज किया. अच्छा, उनकी वॉइस और भी आ गया था सारा.
सर आपने
इमोशंस के लिए
जी जी
आप रेडी फॉर आइडियस
ideas. आपने हाँ जी आई प्रॉब्लम्स है. वरुण आपने
Gastric ailments usually confuse. I never describe as a good person. I complain for darkness by gastric ailments. But only I describe also gastric ailments and usually confuse desire for sweets, craving for sweets, dietitious behavior, all these things are like constitutional. Recently, a case of 12-year-old child has come to the case में first time manifested actually originally diabetes and all the missing therapy we also have complaints that Medica anxiety but I did not find any system in past बहुत छोटा सा brief सा therapy बना उसके अलावा very interesting actually because it's stronger to it's not a these but please what you believe in gastric complaints that will know that you know only gastric and urinary complaints are problems.
आपने eyes आपने
eyes complaint
Sir, gastric complaints where nervousness is very marked in the patient, and also एक केस में I have used for sexual troubles also. Again जहाँ पे nervousness was there, impotence.
सर मैंने अभी रिसेंटली जो किया था अपने डॉटर मेरी डॉटर छोटी 1-2 months के सिवा, तो उसको आई में यही ड्रेनेज डिस्चार्ज था ऐसे करके, तो उसको दिया था 30। तो सर 2 दिन के अंदर शी वाज कम्प्लीटली फाइन और बहुत अच्छा काम किया। और मैंने 2-3 ओसीडी के केसेस में बहुत अच्छी इसके रिजल्ट आए हैं। मतलब कोविड के बाद था एक केस को स्पेशली, ही वॉज अ पुलिस मैन और वो रिज़ाइन तक देना चाह रहा था अपनी जॉब से, मतलब दे दिया था, दो दे वर नॉट एक्सेप्टिंग, क्योंकि बहुत अच्छे थे वो अपने डिपार्टमेंट में। तो सर उनको ट्रीट किया था हमने। ही वॉज माई फादर्स कलीग थे, वो जूनियर थे, तो ही केम टू मी विद ओसीडी। तो उसमें सर आर्जेंटम से ही केस ठीक हुआ था और नाउ मतलब वो बहुत अच्छा अपना कर रहे हैं। और ऐसी एक और ओसीडी का केस था, वो मेरा पुराना केस था, बेसिकली बच्चा था वो। जैसे उसने 10th पास की तो बहुत अच्छा, अकेडमिक्स में बहुत अच्छा था, तो उसको सडनली 10th के बाद धीरे धीरे सिम्टम्स ओसीडी वाले डेवलप होने शुरू हो गए थे। तो आर्जेंटम के कुछ सिम्टम्स थे बहुत मार्क्ड, मतलब आई डोंट रिमेंबर द होल केस। तो उसमें भी वो बच्चा नाउ ही इज़ गोइंग LLB फाइनल ईयर, तो बिल्कुल सेट हो गया।
Sir, recurrent sore throat, recurrent conjunctive attacks, dyspepsia. Mainly, I observe hardness in the body. So, teacher का केस है, sore throat बार बार हो रहा है, desire for sweets, लेकिन स्वीट लेने के बाद कंप्लेन, and there's a hurriedness, always बैटिंग रिपोर्ट्स भी देखने को। सो देयर इज़ अ लॉन्ग केस जो चला। सो बाकी आइस में तो बहुत कॉमनली कंजक्टिविटीज है और डिस्पेप्सिया।
One week of LN1 say he started spending the days without painkiller and all that. And after treatment is ongoing, Wadhwani cases मुझे याद नहीं है this science.
Vocal cords is because it's the constitutional necessity.
Sir, I also took one case of vertigo, looking at the highlights buildings, and after that vertigo, sort of vertigo, patient used to develop headache for 2 days. In that case, initially I tried few other medicines, but in the week it was resistant.
Okay. So then what are the most important symptoms of mind of Alzheimer's? So what we know, we discussed apprehension. Yeah. then we said Farrington.
Impulsive.
Impulsive.
Fear of heights. Fear of heights.
More than that, he uses that apprehension. Apprehension of what is going to happen. Okay. So, we said fear of heights. Okay, what else? Sorry,
Crowded place.
crowded places. That's missing because of fear of heights, major because of that. What else do you know about mind?
Traveling, this patient said that when I am living, so I generally keep on reading one chapter because I'm so afraid of late and
Okay. Okay. What else? Claustrophobic. Claustrophobic is time passes too quickly. What else?
Mutual fight place या lift वगैरह में
हाँ, that's claustrophobic. Fear of closed spaces.
Initially culture.
They're very particular. So they're again they're apprehensive about time. What else?
The fear of the reason that he has some incurable disease, the hypochondriacism.
Yeah, so they're all
Beta plus
they're all
application.
offshoots of apprehension. What else? What else? Okay, there is one most important feature of Argentum Nitricum. Ailments from unusual and long continued mental strain. Unusual and long continued mental strain. Okay?
So it can be of any type.
I'll give an example. And that is why, because of this unusual and long continued mental strain, the patient becomes emaciated, appears old. And where is the emaciation most marked?
Neck.
Neck. Especially in the legs. Okay? Okay? And that is the reason why they have a strong craving for sugar. So remember, Argentum Nitricum, thyroid gland, they have the strongest craving for sugar. So they will not have rasgulla. They'll have the syrup with rasgulla. For all of us, it's rasgulla with the syrup. For Argentum Nitricum, it's the syrup with rasgulla. Like if they have dry rasgulla, they will not enjoy it so much. You give it dip with the chashni or syrup, then it becomes enjoyable. Argentum Nitricum and thyroid gland, the highest degree of that craving. So you say there's a craving for not sweets, craving for sugar. And then they have so much of it that it aggravates. unusual and long continued mental strain. So, we recently treated one very senior bureaucrat, and in last 10 years, he said that he had lost about 30 kgs of weight. He'd become diabetic and he'd become hypertensive. He'd had 2 episodes of EIA. Okay? He lost a lot of weight, and he said, you know, in 10 years, I have aged 30 years. Okay? And he said, because currently I'm in charge of a department where I can get a call at any moment and I cannot miss the call. Okay? Now whether that call is coming from the highest authority or the lowest, any of his subordinates or subordinates subordinate, but he's in that critical situation where he's supposed to answer. In certain cases, he's supposed to answer by the second ring. In certain cases, he has to answer before the call gets disconnected. Okay? That is a strong, long, continued mental exertion. Okay? So that's unusual mental exertion. And then it is long continued. Okay? And that makes him appear older, he loses weight, and then the series of ailments follow. Okay?
Sir, ailments from mental strain is there in area of self-help.
Right? So what happens is, like for instance, Califos, also remedy, picric acid, also remedy. Now what happens with, so this is where you have to understand the exact adjective used in the keywords. That's unusual. So he's been a bureaucrat for 30 years now. But in last 10 years, this has been unusual and long continued mental strain. So it just came as a shock that he was transferred to a certain position and now he cannot exit from there. He's not allowed to retire because he's super efficient. And you know, imagine if he's continuing with that. Have you ever seen there's an authority called ABC? It's called an air traffic control. Okay? So generally people when they become air traffic controllers, they are usually given a tenure of 3 to 5 years. They never are allowed to continue beyond that. Okay? What does an air traffic controller do? For instance, we have Delhi airport. You know, you have all the flights coming in or going out. So there are air spaces and there are multiple flights taking off. And there has to be a certain distance between the 2 flights. There has to be a certain time gap between the flights landing or taking off on the runway. A little bit of error can cause tragedy, extremely severe tragedy. Okay? So they're supposed to sit on the street and just look at the screen. They're supposed to focus on it all the time. And within 3 to 5 years, they are depleted. That is, for instance, one of the examples. Okay? So, we treated a lady who gave birth to twins, and both of them were autistic special twins. Okay? And then at the same time, she lost her husband. Okay? And the kids were growing up. And then the in-laws were keeping her because her maternal side was not very strong. So she was staying with the in-laws, she was supposed to stay in the house. And she was not very well educated. And the in-laws were supporting her financially, but in return for that there was a cost. So she had to manage the household chores, cooking and everything. At the same time, she had to manage the 2 special kids. So she primarily came to consult for the kids, but then she had an extremely old burnout repeated. Because she said, I don't know, when I'm stepping into the kitchen, what is happening back there in my room. And when I'm back in my room, I don't want to leave anything undone in that house. And then she had developed intense itching on the right leg, what we call lichen simplex chronicus or neurodermatitis. And she said, every time I hear a vessel fall or a thump, and my heart is running and I'm having palpitation, what is happening? And she said the only way I calm myself down is by just putting in a spoon of sugar into my mouth. That calms me for a moment, but then it increases my anxiety. Okay, so that's unusual and long continued. You understand? So this will always be, generally Argentum Nitricum patients will always appear older than their age, generally, because the apprehension makes them so. Okay? Any other symptom of mind?
What study say you are supposed
So it's not about studying. So even when they are studying, they'll be thinking more, what will happen? What if I'm not able to give the exam well? What if that question comes? So they're too scattered, they keep on working hard and then they develop, for instance, a nervous diarrhea. Or for instance, another symptom of Argentum Nitricum is an impulse to pass urine, stool before stepping out. So, in many patients you find they'll say कि जब भी घर से बाहर निकलना हो ना, ये एक बार तो वॉशरूम जरूर जाएगा, कभी कभी वो हो के आया है और चाबी उठा के जा रहा है, कह रहा मैं एक बार फिर हो के आ रहा हूँ. That is another feature of Argentum Nitricum. Okay? What else? You know. What else? Any other symptom that you know?
चल रहा है मेरे पास आगे
जी, जी.
चक्कर उनको काफ़ी आते हैं सभी बैलेंस नहीं करता है बच्चा तो एंजाइटी बहुत आती है
जी.
इम्प्रूव है बट अभी केस चल रहा है
Then there are certain delusions that occur in Argentum Nitricum. For instance, they have a fear to go beyond a certain point. So they have that fear, they cannot go beyond a certain point. Or what if that building might fall on me, for instance. Okay? So they have certain delusions that are also there. Okay? So, please. So, this time passes too quickly is actually a symptom of another ability. Aditi. Come on.
Leading to Reliant
So relief is high. Okay. So tell me which remedy. Soma, tell me, having skin, you can do it. Check. Which remedy is Actually, it's very slowly. This is a wrong symbol. And that's
cannabis indica. Slowly.
Coculus. Coculus.
Yes, it's populous. Is there that any symptom without? I just didn't want to point it out at that time. I just didn't want to point it out at that time. Here, symptom other than that. It's actually Gyandas. So, coculus syndrome is one remedy where you find Gyandas 2 people. So there's a girl that we were treating who had seizure disorder, okay? And she said every time, just before the seizure, I think everything around me is moving in a fast pace. And then she got coculus indicus and she never had seizures after that, but she had for 10 years.
So what you said, everything?
Everything is in a fast forward movement, suddenly, just before the seizure. That's time passes forward. That's coculus indicus. Have you seen that? I refer them to science. Yeah. So, what other symptom do we have of Argentum Nitricum? Okay. So, unsteady gait, especially when
Feel someone is observing.
they feel unobserved. So, there's a better word that we use in Argentum Nitricum that is called faltering. Okay? So, faltering, for instance, faltering speech. Okay? Because of too much of pressure and strain, their speech starts getting faltered. So they might get stuck while talking, make mistake, or for instance they start losing their voice. That's also faltering. And they have, and somebody spoke about erectile dysfunction.
Yes, sir.
So it's also one of the remedies for faltering erections. So just at the time of intimacy, the erection fails. Also Argentum Nitricum. Okay? Then faltering gait. That's also, so it's a pathological gender. Because the same faltering is also seen in the intestinal abdomen. Okay? So it goes from the just before an exam, your courage will falter. You understand? So it's a pathological gender. It transcends through all the realms, from mind to the body to the pathology. So faltering is an important pathological gender of Argentum Nitricum. Are we together? Yeah? Then yeah. So a few years back is when we saw a kid with Down syndrome. Okay? Now, have you you seen kids with Down syndrome in practice? Yes, no? So we saw this kid and with all the features as expected of Down syndrome. And he was about 9 years old, but he had still not developed his speech. Okay? And he was quite socially insecure. So he was not socially withdrawn, but he would be socially insecure. So if the mom would take her out in a party or in a garden, he would just not interact with the kids. He would like to just, even if you look at him, like when he was brought to the clinic by the mother, he was not really making an eye contact. He was just, looking down or just avoiding, and not like an autistic kid. There was not a lack of eye contact, because he was generally shy. Okay, so when we went through the intrauterine history, and that's when we found that in the middle of the pregnancy, which is somewhere in the 4th or 5th month, was when her husband lost his job, and they had house loan to pay off, they had car loan going on, and nowadays, there's also this that people pick up appliances on, EMIs and everything. So they had a lot of EMIs to pay off. And then there was pregnancy, and then there was a baby on the way, and the mom was really, really apprehensive. Kaise chalega, kya chalega? And she said, I could not sleep for most of the nights thereafter. So my husband was calm, कि ठीक है मिल जाएगा यार, कोई ऐसी बात नहीं है. But she said कि I had a big problem. And she said the only way I could calm myself was when he lost his job in the few months, it was winter time. She said, I would just not stay, I would just walk out, and I'd be walking out. And she said, I always used to pitch a little bit. At that point of time, I could not tolerate warmth in any form. And I wanted to just walk out and be out, and I could not sleep. I was thinking all the time what to do. And she said, every time I would have food, I wanted to have something sweet right after that. And soon after that, I wanted to have something strongly salty, so that craving for salt and sugar was also there. And when you read the section of mind and sensoria in Argentum Nitricum, you find very strongly features of imbecility and shyness. Okay? So when we prescribe Argentum Nitricum to the child, so the first thing that came up for the speech, he started talking. And secondly, he also became socially more responsive. So Down syndrome develops. Yes. So when you read the symptoms of mind of Argentum Nitricum, for instance, we also find imbecility and shyness is a very strong feature. So then there is one symptom of Argentum Nitricum mind that you should all know about. It's singular to Argentum Nitricum. Okay? When I say singular to Argentum Nitricum, so Argentum Nitricum personality has fascinating daydreams, and they have horrible dreams at night. So they will have all sorts of fascinating, fantasizing daydreams. They will be building castles in the air, as they say. And when they go to sleep at night, they wake up with the most horrible dreams. Okay? So that contrast is similar to Argentum. Okay? Like for instance in selenium, we see that feature that in dream they remember what they had forgotten during the day. Okay? So Argentum Nitricum has one very, very different aspect. So remember, you must always go through the old textbooks because you read so many symptoms which you probably may find in patients, but you don't know how to evaluate them or include them in the totality because you haven't studied them. Okay? So, for instance, on your phone, open homeoin.org, the website homeoin.org, and then open Boger Bollinghuisen's characteristics and repertory in Argentum Nitricum. Argentum Nitricum. First symptom क्या है? Okay, you also find that symptom of brain there. No? See that? Okay? So it's not just the cause. The remedy has to cover the effect also. If it only cover the cause, then you can have Argentum Nitricum, you can have Telsemium, you can have silica, you can have acid phos, and many other remedies. Okay, to consider. Are we together? Yeah? Great. Next.
Sir, in some patients, in cases of
One is
Sir, in some patients of generalized anxiety disorder, when they have an episode of anxiety, they reduces weight like anything 20 to 25 kg and become so emaciated that the people they look at them.
At that time,
And when they are out of this anxiety,
so at that time, in diagnosed psychiatric patients with anxiety disorder, you have to be cautious while prescribing an remedy like Argentum Nitricum, because then that becomes a common feature. Okay? So,
so in that patient I had this case of anxiety. He had it, I was giving importance to the physical symptoms. He had a habit of biting nails with the skin of the nails. On that basis I gave him carcinosin and he improved with that.
okay?
His anxiety came under control, but he has to take some anti-anxiety medicine as well. But this carcinosin helped him to come out of fear and all.
So, Argentum Nitricum, okay? Now, what symptoms do we know of eye?
Almia neonatal.
So you're telling me diagnostics. I need symptoms.
Redness of eye. The stickiness, in the morning or
So what are symptoms of Argentum nitricum? Yes. So for instance, जो सर ने बोला ailments from eye strain. Okay. Okay. Especially in inadequate light. Okay. So Argentum nitricum, Netromio. Okay. Most important remedies. Ailments from eye strain in a dark room. That's a symptom of Argentum nitricum. What I want from you are symptoms, not diagnostics. Okay, like for instance, the eye symptoms are better in cool air or by cold washing. Okay, this is a symptom or eye strain in inadequate light. Like for instance, there is a greenish discharge. Okay? There's also a yellowish discharge. Okay? Then there is a sensation of rawness. Okay? These are symptoms. Okay? Sorry. Please. So, there is a peculiar sensation in Argentum nitricum. Okay, the sensation of tightness. Okay, there's a sensation of tightness, as if there's a tight band around the part. Yes? No? Yeah? So as if there's something tightly wound around the head or around the joint. Okay? So that sensation of tightness is there, and at the same time it is better by tying something tightly. So that's it's uncommon.
But sir, how the patient will describe this?
Exactly like this. Okay? So this is uncommon to, this is what we call a characteristic symptom. Striking, singular, uncommon to basic pathophysiology. We have a sensation of tightness and better by time. For instance, there's a remedy called Medica. Okay? It has a sensation of weight on the vertex and better by pressing it or just keeping your hand on it. So that's uncommon to the basic pathophysiology. These symptoms are characteristic symptoms. Okay? Found in very, very few remedies. Okay? And they're singular to them. So remember, like for instance, anacardium also has the sensation of a band around the part, but there's a sensation as if there's something stuck inside, what they call a plug-like sensation inside, with a tight band outside. Okay? Then there are other remedies like carbonic acid, anacardium, nitric acid, sulfur, which have a band around the head. You know, they say there's a headband around, or as if there is what they call an India rubber band which is drawn around the head. Carbonic acid, anacardium, nitric acid, sulfur. Okay? Then, are we okay?
Yes, sir.
Yeah. Then there is a sensation of expansion. Argentum nitricum also has a sensation of expansion. So especially with the headache, they feel their head is expanding. Okay? And then they are better by tying it tightly. So, now this is just something that we've studied in school time. So if you remember, when we used to study history, we used to read about Hyun Sang. Hyun Sang was a Chinese scholar who was passing through India, and he's given a description of India in those times, many centuries back. Okay, and in his Hyun Sang's tale, he talks about when he's walking through a city, and at some point of time at night, he finds a man who's just walking around in anguish on the streets. And so he just observes that guy because he's just walking back and forth in the middle of the night on the street. Nobody's there, and he's got this tight copper belt around his belly. And he says, okay, why are you doing that after some time? He says, I have imbibed so much of knowledge that I feel my belly will burst. And that's why I've tied a tight copper belt around myself. So that kind of a sensation of expansion, with that apprehension, that's making you walk in the middle of night, and then you have a tight belt around to relieve that. Okay? So that's a delusion. It's a delusion of the mind. Okay? Whatever psychiatric illness, it's just a corollary. It's not that you'll find patients like that walking on the road with Argentum, nothing like that. But just to tell you, okay, so that is another sensation that is there in Argentum nitricum. Okay? What other sensation do you have? Okay, you have, because it's a great neurological remedy, so lots of neuralgias. Yes, splinter-like sensation. Okay? Splinter-like sensation. Then you have lightning-like pains. Then you have grinding pains. Okay? Lots of such sensations you find in Argentum nitricum. It's a great neurological remedy. नहीं बात करो ना करो सबको डर गया करो सर ये ओके Okay, next we talk about okay, the symptoms of GID. Tell me symptoms of GID which will help you determine Argentum nitricum.
Rumbling sensation,
Craving for
mucus
sweets.
passage to stools,
Okay?
diarrhea,
Yes. Greenish.
Greenish
Yes.
diarrhea.
Okay. So generally we say mucus.
bleeding also,
Long shreds of mucus. Long shreds of mucus. Okay? So when they say long shreds of mucus, it seems as if mucus or pieces of intestine are passing out. The similar thing is also there in Asylum European. Okay? Okay? So there's one more thing which is common in Arserum and Argentum nitricum. What is that? जो बताएगा उसको बालों चॉकलेट देगा. Should you write?
Burning.
Paper is on the turn.
Common between Argentum Nitricum and a serum. Yes. Better from washing with cold water. Better from washing with cold water. आप लोग क्या करोगे चॉकलेट का? Okay, so better by washing with cold water. That's a very important common modality. Okay, so mucus, and you actually find as if scrapings of intestine are coming out. That kind of mucus is Argentum. Okay, so now you may prescribe it in different ways, but when I say symptoms, you should know exact symptom of that part so that you can consider that kind of thing. Okay. Then, what else do we have?
Noisy diarrhea.
Yes, a lot of flatus with diarrhea. Okay, so that's what makes it like Gyandas. Now remember, this is for you. This mucus is different from the mucus of aloes. Aloes has lumpy mucus. This has like pieces of long mucus as if it is kind of lip shape. Are we together? Yes. Okay. How do we know that? By Medica. That's the exact correlation which is also given in bogus synoptically and iron skin. Same correlation. You have to understand. And when you go into the Medica, then you find why aloes is not mentioned here and the other way. Okay? So they are differentiating in the least possible ways, but in exact ways. Okay?
Sir, in aloe there is one mental symptom as well, very dissatisfied and irritable when he is cold.
Yeah, true. Right? So, what else do we know? GIT. Come on, it's almost everybody said they've used it in GIT. What symptoms can you tell me on GIT? Yeah, so apprehension, so what we call, let's say nervous diarrhea. Okay, what else?
Benching along the GI segments.
Loud
So-
belching.
Yes, loud belching for years together of a long duration. Loud belching of a long duration. Okay. Any other symptom?
Diarrhea as soon as it drinks. Or sleep time.
Diarrhea from sleep.
So, we all have read James Stuyvesant's lectures on Materica. So where the mother has sweeping and then the child suffers with the diarrhea in consequence. So I've had an opportunity to see exactly that. So one of my students in South Africa, and she had a patient. The kid had absolutely green diarrhea, and I said, okay, green diarrhea is the mucus in it. She said, little, not too much, but it's very gassy green diarrhea. I said, okay, ask the mom what did she eat before the child had diarrhea, because she's feeding the baby. So she said, oh, she had a lot of cake. I said, oh, now she needs Argentum Nitricum. And that was exactly after the sweet because of the sweetness of the liquid. So what happens is pulsatilla will not have that kind of a gassy diet. Not that
Changeability is good.
Sorry?
Changeability of stool is good.
They may have changeable color of stool as well, but basically even if they have a greenish stool or a yellowish green discharge, but they don't have that kind of gas, and then it will allow the sweetness of the cake. Okay, so this much for today, and then we continue next time, please. Okay, take care. Thank you, guys.
Thank you, sir.
Thank you.